Time for our Be Healthy report now. Were you doing some yard work this week and maybe your back is aching after planting and a little mulch shoveling? Or if you just suffer from chronic back pain in general or even serious back pain, you're in good company. 10 million Americans have aching backs too. Dr. Isaac Moss is an orthopedic surgeon at UConn Health. He joins me now to talk about some hopeful treatment. Good morning to you and thanks for coming in.
Good morning. Thanks for having me.
So this is a chronic complaint for so many people, isn't it? Back pain, and it can come from so many different places.
Probably about 85% of Americans will have back pain at some point in their life. I'm certainly in that group.
Really? And was yours from an injury or it just
I don't know if we're designed to walk upright for as long as we do, perhaps. And so it's one of those things that happens to everybody at some point.
So I think obviously when you suffer with it, and especially if it's chronic, the first thing you're thinking is, what can I do to get rid of it? It's debilitating in many instances. It's hard for life to go on if you're constantly thinking of that pain, so what are some of the treatments that are available? So
fortunately, most people do get better and don't turn into people with chronic back pain.
Thank goodness.
The treatments start very simply with exercise. We hear lots of people that they have problems with their core, for instance, is a very important thing. So things like Pilates, which is actually now pretty much in vogue and available everywhere, that's a great treatment for someone who's having an aching back. Maybe it's not so bad. Maybe you don't even have to go see your doctor. But you can just get a video or go to a class and start doing some Pilates. That's a very nice way to probably help a lot of your back pain.
Do you find that a lot of people think, oh, the last thing I should be doing is I should be resting it and laying flat? That actually sounds like it's not the way to go.
So that was probably about 20 or 30 years ago. They said if you had a bad flare-up of back pain, go to bed until it gets better. And it turns out that is probably the worst thing you can do.
Is that right?
Probably maximum 1 or 2 days of rest are good. And then you need to start being active again. You have to strengthen the muscles around your back, take the pressure off the spine itself, and most people that way, their pain will resolve.
Now there is another treatment available, and this is for people who really have hardcore back pain, right?
Right. So if you've done physical therapy, you take anti-inflammatories such as Motrin or something like that over time. Maybe you've even gone and seen a doctor. You've had something called an epidural steroid injection, which is where they put some cortisone around the nerves in your back, so giving a local delivery of an anti-inflammatory as opposed to taking it by mouth. If you've done all these things and those haven't worked, then yeah, maybe you should consider seeing a surgeon. And when you go see the surgeon, certainly there's lots of different ways to do back surgery. And again, like you said, it is for people that have really tried everything else, or in this state where really life is not really difficult to live, difficult to do your general activities. That's when it's worth thinking about surgery for back pain. Traditional surgery is really to go in through your back. You actually have to open up the spine, and what we do is we fuse the levels of your spine, so those discs.
Do you still have mobility after that to the same degree?
Yeah, that's
not as much.
Most common question. Actually, people, turns out, sometimes after surgery feel they have more mobility because you're only fusing your lumbar spine, which is the low back. That only has about 5 different levels, 5 different discs. Most surgeries only fuse 1 disc. So you're fusing that 1 disc, which was unhealthy and painful, and the other discs are still moving. So people actually feel now they have more mobility because that painfulness is gone and the rest of their discs, which hopefully are healthier, are doing the job.
Well, what's really encouraging is no matter what level your back pain is on at this point, there sounds like there's hope and treatment available. So talk to your doctor, find out what step to take next.
And I think, there's sort of this big fear out there that spine surgery is this horrible thing. You're going to go to your doctor, they're going to do a big procedure, and maybe it's going to be worse, maybe something horrible will happen. And I think that really isn't the case. There's lots of great things available. There's lots of new surgical procedures that are available. The one that I tend to use a lot in the right situation is something called the lateral interbody fusion. So traditionally, lateral means from the side. Traditionally, surgeons go from your back. In this surgery, you can actually go through the side and accomplish a very similar goal. The advantage is, around your back, we all feel our muscles around the back. Those are some very, very strong muscles, and they're very sensitive to damage. And so there's almost a collateral damage in traditional spinal fusion because you have to go and take all these muscles off the spine in order to just do the job. And it's worth it if some of your pain goes away.
Definitely.
But again, maybe we could do this better. And the lateral interbody fusion goes through your side, avoids all of those muscles, and can really accomplish almost the same thing in certain situations.
So the moral of the story, it sounds like, take care of your back if you can, but if there is some issue, if you're dealing with pain, don't live like that anymore. Check out these different options. Thanks so much for coming in, Dr. Moss. We appreciate it.
Pleasure.